There it is. Let's go.
Yes, we're live again tonight. Wonderful. Give thanks and praises to the Most High, for giving us another day of blessings, you know what I mean? All right, tonight we're going to talk about colon cancer and brain cancer. And the reason why there's a little 8-year-old boy, I think in one of the states in America, that is fighting a brain tumor in his brain, And, are we there? States in America. Yes, that is fighting the brain. It's fighting a brain tumor. He's have a cancerous tumor in his brain. 8 years old, and there is lots of other children who have or is fighting cancer of the brain. You know what I mean? So we want to talk about that and how you can prevent brain cancer. And if you have it, there is natural things you can do. If you catch the tumor early, I'm going to show you a PowerPoint on how the tumor goes into the brain, and I mean in the colon, and you can try to avoid these tumors from affecting your everyday life. Yeah, wonderful. And we're going to have our sister here, Rona. She's going to ask some questions about some of the products that we carry, and we're going to give you a full detail of what we use to treat different forms of cancer. You know what I mean? Especially colon cancer and also brain tumors or brain cancer. As I said before, the 8-year-old boy is fighting brain cancer. No, he might pass because apparently he's not eating now, he's not talking now. So we have to really look out for our children and feed them the right foods so that they can stay healthy. That is very significant. You know what I mean? All right. So we're going to go to the first chart. Brother Dan, we have our Brother Dan here now, and he's instrumental in doing our videos. We have to give him lots of blessings. Yeah. So tonight we're talking about colon cancer and brain cancer because colon cancer is on the rise, and they're the brother. And if you're looking at the program tonight, brother, good luck to you. I know you're fighting cancer in the brain, and from the time we're treating you, you are doing so well. You can put a post on it to let people know how you're doing, and your tumor is not back; it's just not growing again because you're doing good things and you change your diet. So I want to thank you, brother from Canada. If you're looking at a program, give thanks and praise to the Most High for life. All right. Because they make you feel that when you have a brain tumor, benign or malignant, that is going to come back. And when you come back, you have to go back and get all these operations. And if you keep certain parts of the body healthy, the tumors don't come back. All right, that's the key. The key is not letting the tumor come back. That's the reason why a diet change is so significant. All right, so we have to be very diligent in how we treat these cancers. All right. Brother Dan, you ready to go to the chat?
Yes, sir.
Wonderful, my brother. All right. So tonight's presentation is colon cancer and brain cancer. And we're going to try to teach you how it grows, how the cancer gets into the colon, how the cancer gets into the brain, and how you can treat these malignant tumors naturally with plants, and how you could prevent these conditions from happening. That's very significant. I always teach about prevention, And when you have brain tumors, it could affect the eyes, it could affect your movement, it could affect your speech. So we have to be very conscious of what we put into our bodies. That's very significant. You know what I mean? First chart. Wonderful. All right, colon and brain cancer. And is everybody seen the chart? Okay. Rhonda, they seen it? Rona, they seen the charts? Okay, everybody's seen the chart clear?
Yes.
Wonderful. Blessed love. Give thanks to the Most High. All right. Now, if you look at the first chart, we have the first 3 charts on the screen. And the first one, again, is the colon. And I always talk about colon health. Colon health is very significant. And I said before that part of the body is called the sewage system. That's where everything goes as waste. If the body cannot remove these waste from that particular organ, you can have troubles elsewhere, including the brain. All right, so that first chart where you see that colon, which is 5 feet long, like a U around your navel, that organ is very significant in keeping tumors away, not only from the other organ, but also from the brain. And if you do have a tumor in your brain, that particular organ is very significant in keeping the tumor from coming back or preventing tumors from coming back if you have a malignant or a benign tumor in the brain. All right. But first, we're going to talk about the cancers or the tumor that is found in the colon. All right. Now, if you look at the second chart, you're going to see the wall of the colon, and you're going to see cancer. That the cancer is growing on the walls of your colon, and the cancer can grow in different areas of the colon wall. It can grow in the ascending colon, it can grow in the transverse colon, the tumors can grow in the ascending colon or in the sigmoid colon. And usually what the doctor will do, if you go back to the first chart, you see if you have, go down to the bottom here, right, and over here, it's called sigmoid over here, sigmoid colon right here, right there, right. If the cancer is there, the tumor is there, and it grows there, it is very difficult to cut the colon and join it back, because that part of the colon is so right down to the rectum or the anus. It is very difficult for the doctors to cut and join that part of the colon if there is cancer there. All right. And if you have rectal cancer also, it's very difficult. And these cancers, what they do when they're in that particular area, they affect the mucous membranes and cause the mucous membranes to produce lots of mucus. So you start seeing mucus in your stool or excessive amount of mucus in the colon wall or in the rectum. And that is telling you that the tumors are also secreting mucus. And we know that mucus is negative, all right? So once the cancer is in a sigmoid colon, it is more difficult to treat in terms of cutting and joining back the colon wall, or the colon itself, sorry. If you have the colon going up to the descending colon over here, what the doctors will do, if that colon is right around that area where you see the arrow is at, the doctor will cut between the tumor and the other part of the colon and join it back, transverse. If the colon is in the transverse colon, over here, right, with the arrow is at again, the doctors can also cut and join back that particular area if there is a tumor growing in there. That's what they do, because they're surgeons. And a surgeon's job is to cut, not to repair naturally. So you cannot blame him. If you go back to the ascending colon over here, and you have a tumor growing there, then your doctors can cut and also join also. But it's very difficult to cut and join when you are when you have a tumor in the sigmoid. And that is why colon cancer is so difficult to repair, because it is found in that area that I call the sewage system, where waste is at. Common sense will tell you, if you have roaches in your sink, you know what I mean, and you're keeping dishes inside there all the time, the roaches won't go away at all, period. But if you spray with Baygon or what you put in, or you clean your sink out, you wash the dishes, the roaches go away. Right, so you have to keep that particular area healthy in order for the tumor not to grow. And if there's a tumor there, and you're trying to get rid of the tumor, you have to keep that part of the body clean on a regular basis. And the tumor will shrink long term using plants. We will tell you what they are. Right? Go back to the second chart, the wall of the colon. Now, if you look at the walls of the colon, you're going to see that there's two types of tumors. There's two sides of it. Now, tumor will grow, and they could grow to 5, 6, 7, 8, 10 centimeters. And the doctor will put his hands around your navel area, pressing his fingers around that area, and he can feel a tumor there if it's there. All right, that's number one. Number two, when you have cancer in that particular area, you get lots of bellyache. You have a lot of pain in the belly, in your intestines, and you might see if that's where the cancer is at. If the cancer is in the sigmoid, you might see blood in the stool. If the cancer is in the other parts of the colon area, you might have bloatedness, you might get pain, you might get indigestion, and the doctor might treat you for gas, or he may treat you for flatulence. And sometimes you don't have flatulence, you have cancer in your colon. So that's the reason why it is very significant for you to check yourself on a regular basis by taking your hands and putting some castor oil around your belly area, over your navel area, and you could take your fingers and massage or run around the area to feel for tumors if they're there. All right, and that's important. What you can also do is take your fingers, 4 fingers, and put it on different areas of the tummy or the belly, and take your other hands and tap that area. If there is pain, it could be problematic. You should go see a doctor. All right, let's go to the third chart. Let's go to the brain. Now, if you look at the third chart is the picture of the brain. All right, and when you have cancer in the brain, if you look at the top of the chart, you're going to see it marked distorted brain tissue. And once you start to have distorted brain tissue in the brain, possibility you're going to get what we call inflammation, because you start getting irritation. Because don't forget, I said before that irritation causes inflammation. And once you have any kind of irritation, you're going to get inflammation long term, right? So when you have a distorted brain tissue, you can get inflammation, which could lead to the one in the bottom here called a tumor in the brain. All right. Now, it's according to which part of the brain the tumor is at. All right. If the tumor is in the hippocampus of the brain, it could deplete lots of magnesium, which help with nerve and muscle function, and you could have troubles in movements of the legs or the hands. And that is a sign of the tumor in your brain. Sometimes some people have a tumor on the pituitary gland. And we did an interview with Dr. Sebastian Peters, and he gave us an idea of why people get tumors there. So we're going to go back to Dr. Sebastian Peters sometime next week and have another program with him, and he's going to explain to you how you get tumors on the pituitary gland long term by imbalance in the hypothalamus gland. All right, we're going to talk about that sometime next week with Dr. Sebastian Peters. Now, if you look at the tumor can grow from 1 centimeter to 10 centimeters in the brain. And the bigger the tumor is, the more difficult it is for you to move around and have movements of different parts of the body, because the brain is like a computer. Back to the first chart again. Once you can keep the first chart healthy, the colon that is, and you keep it clean on a regular basis, tumors can never form in the brain. Back to the third chart. Tumors can never form there. When the colon is healthy, I think Dr. Sebastian Peters mentioned that also, the stomach, which is the earth. So the earth is very significant in order for us to keep that particular part of the body healthy, which is the brain, the computer. All right, go to the next chart. Right, now causes of cancer in the colon. And constipation is one of the main causes of it. If you're constipated and you're not moving waste out properly, it's common sense will tell you that you're going to have trouble in the colon long term. And cancer is one of them. So the main cause of cancer in the colon is constipation. And lots of people don't go to the bathroom in 3 days. They don't go. And I'm saying, and doctor says that's okay, that's normal. That's not normal at all. You must go to the bathroom on a regular basis every day if you're eating food 3 times per day. That's common sense. All right? You must eliminate waste from the earth. All right? So constipation is one of the main cause, or is the main cause of colon cancer. The next cause of it is Crohn's disease. And we had a program on bowel disorders a couple of days ago on Crohn's disease, and those are conditions of the colon that cause inflammation. And again, inflammation caused by irritation, and that causes you to get cancer also. Ulcerative colitis. You have an ulcer in the colon walls. That can also aggravate the lining of the colon. If there is not enough glutamine in the diet and the wall becomes weaker, you could get cancer from ulcerative colitis too, because the ulcers is so in your belly. All right. If you have the pylori bacteria, and that could also cause you to have cancer in the stomach too, in the digestive system, the pylori bacteria. So always check your doctor for a test to see if you have the pylori bacteria, especially if you have trouble with acid reflux and any kind of digestive disorder. That's very significant, especially ulcers. All right, because it could turn to cancer too. Duodenum ulcers, and that is the beginning of the small intestines. And usually, if you have ulcers there because of the pH that changes from alkaline to acid, and cause you to have ulcers there because acid causes ulcers. They can't do that. That's a fact. If there's ulcers in the duodenum and it changes the pH of that particular area, you can get ulcers there because the pH is supposed to be alkaline. And once the alkaline pH changes from, let's say, 7.45 to to 5.0, you can get an ulcer, and ulcer that could cause cancer there too. All right? Those are a few causes of colon cancer. And if you have a genetic predisposition, meaning that your mother, father, or uncle or grandfather had it, and you eat the same way like they did, you can also get colon cancer, right? Go to the second chart, colon. Now, if you look at the second chart, you're going to see that down in the bottom, go into the sigmoid colon. That's where lots of tumors grow. And why do they grow in that particular area? Because lots of people don't squat. All right? We're going to show you a tool that you can use to squat when you're in the bathroom. Now, when you don't squat, when you're in the bathroom, because as I always say to people, Dan, the worst invention of the white man is the toilet bowl. Don't forget that. I told you that. And the reason why, because what he did when he invented that toilet bowl, he didn't teach us how to use the toilet bowl properly. So he told us we have to put our feet on the ground while we're sitting on the toilet bowl. But that's not the right way. While you are on the toilet bowl, you have to put a 1-foot stool in front of the toilet bowl. And once your feet is elevated, this part of the way have to circle around that sigmoid colon right there. That part of the colon will relax. And once that part of the colon relaxes, then all the waste will move out. Put your feet on the ground without using a stool or squatting on the toilet bowl, you have waste matter, or you are squeezing your sigmoid colon. And what happens to you is lots of the waste stays in that particular area and seeps into the sigmoid and cause you to have polyps, which cause you long-term to get colon cancer. Okay? So always squat when you went to the bathroom. Next chart, second one. If you're looking at the normal colon, that's how your normal colon is supposed to look. That's how it is. That's how it's supposed to be. You see? When you have a good, regular bowel movement on a regular basis, that's how your colon is supposed to look. Clean like that. All right? Although it is called a sewage system, but you can never, you can never have waste sitting in that area because it is a sewage system. And once you have waste sitting there for a long period of time, the heat that is created will also will invite bad bacteria, which cause you to have different troubles in the bowels or in your digestive system. All right? The third chart. That's colon cancer right there. So if you don't have good colon health, suffering from constipation, and you have all these bowel disorders, and you're not going to the bathroom on a regular basis, meaning that you're going to the bathroom 4 days per week, 4 days per week, 3 days per week, 2 days per week, once per month, once every 2 weeks. Once you are going to the bathroom once per week, once you are going to the bathroom 3 days per week, once you're going to the bathroom once per month, you are at risk of getting colon cancer long term. And not even colon cancer, but also liver cancer too, and brain cancer too, or brain tumors. That's a fact. They can't do that. All right? Because you are causing your sewage system to be stagnated. And once you have stagnation, you're going to have things that won't grow. That's common sense. It's common sense. You understand? If you have things moving, you don't get pain. If you have things, pain. If you have waste sitting in your colon, you're going to get a tumor long term. All right? Or you're going to get some kind of bowel disorder long term. All right? So you must be able to move your bowels on a regular basis. And if you combine your foods properly, then you will be going to the bathroom 2 to 3 times per day. All right? That's why I go twice, 3 times per day, and I eat once per day. All right? Next chart, Brother Dan. And that's what doctor will tell you. Let's look at the treatment for colon cancer. We're going to talk about back up. We're going to talk about who in a while, because Sister Rona going to ask some questions about holy immune. Holy immune, IP6, and IP6 is very significant. And I like to mix IP6 with glutathione and NAC. And remember, we said the last program we had, this presentation, we said that L-glutamine is important because if you are deficient in L-glutamine, the walls of the colon become very weak and invites different bacteria, aldehyde, and all these chemicals that cause you to have troubles long term there. So L-glutamine is very significant in keeping your colon walls healthy. MCP means modified citrus pectin. And what that does, and that comes from grapefruit skin, orange skin, and tangerine skin, all the citrus. And that's what they call it, modified citrus pectin. What it does, it uncoats cancer cells that is camouflaging as good cells. So if you have a cancer cell in your colon, and the cancer cell wants to move, and he wants to fool your immune system, he is going to put a coating on the cell, and he moves. And once he's moving into the circulatory system, your immune system takes him for a good cell and let him pass. But the MCP uncoats him. And once the MCP uncoats him, it gives your immune system enough ammunition to kill the cancer cell. That's significant. They all come from nature. Sheep sorrel, very important. Sorrel, again, we call it hibiscus in the US. That's also good for colon cancer. Dandelion root to clean the liver, and burdock root. That's if you have colon cancer. And when you have colon cancer, don't forget, especially if you cut and join your colon, do not do any colonics. Don't forget that. If you have colon cancer, do not go to any colon therapist and do colonics, because it can move the cancer cells and cause them to get into the walls, into your bloodstream. Do not do any colonics once you find out that you have colon cancer. You can do enemas according to where the cancer is at. So if the cancer is in your, go back to the chart again, Brother Dan, back at the top. Right. If the cancer is in your sigmoid, do not do any enemas. If the cancer is in the transverse over here, you can do enemas, because the enema will wash just from the sigmoid up to the splenic flexure. But do not do enemas unless you are guided by a trained herbalist or a doctor who is trained in colonics or enemas before you embark on doing an enema if you have colon cancer. Okay, wonderful. Go back to the next chart. All right, the next chart. Let's look at the brain. And look at the brain. You see right at the top of the brain, that's where the tumor is at. And remember that we said before that it's according to where the tumor is at, you could have troubles in different parts of the body. So if the tumor is over by the pituitary gland, you can have troubles in the eyes. If the tumor is in the hippocampus of the brain, you can have troubles in the nervous system or in the muscles in terms of movements. All right, so you have to know where the tumor is at. The bigger the tumor becomes, is the more difficult it becomes for the patient to walk. All right, don't forget that now. So what we have to do, in order for us to keep that brain tumor from growing or shrinking the tumor, we have to starve the cancer cell from creating blood vessels. We call it angiogenesis. And once we can starve the cancer cell from blood vessels, the tumor will shrink. But in order for us to starve the cancer cell or prevent the cancer cell from creating blood vessels, we have to go where? Book over here, brother. We have to go right there. We have to go to the earth. You understand? Hey, Lily? We have to go to the earth. We must go back to the earth. And if the earth is clean, and if the blood is purified, because Michael Tira taught us in classes, he said, if you can keep the bloodstream clean and keep acid from the blood, you will never get sick, never get the disease. So if you get the disease because of acidosis, and you have a brain tumor, and you want to prevent the tumor from growing, or you want it to shrink, you must keep the earth clean, and you must keep the bloodstream clean, and you must keep your immune system intact. Otherwise, your tumor will grow. To prevent that tumor from coming back into your brain, you must go to the where? The earth. You have to go back to the earth. You have to go back to the digestive system. You have to go back to the large intestines. You have to go back to the pancreas, because they are the reasons why you get a tumor in your brain. Don't forget that. And we're going to talk to Dr. Sebastian Peters again next week, and he's going to show you why you get tumors in the pituitary gland. All right? We came to that already. Let's go to the brain now, the colon. Now, look at the stages. In the medical system, they have stages of cancer. They have stage 1, they have stage 2, they have stage 3, and then they have metastasis of stage 4, right? Now, if you look at the charts, you're going to see that stage 0 over here, there is no tumor there. You understand? Because you're keeping the colon well, or or you're keeping your digestive system healthy. You go to stage 1, a tumor start growing there. See, when a tumor start to grow, it don't give you a problem. It might take 5 years before you get a symptom, but it's there. See, and go to stage 2 now. Stage 2, it grows a little bigger, and then you might have trouble with nauseated feeling, a little pain in your belly, and you might think it's just gas, and that's a sign that a tumor is in your belly. Okay, the next one is stage 3. When the cancer reaches that particular stage, now your tummy start to get a little bigger because the tumor is there, and you start having more pain in the belly. If it's on the right side of the intestine, you're gonna get pain there. If it's on the left side, you're gonna get pain on the left side of the belly. But those are symptoms that something is wrong in your colon. Lots of pain, and the pain don't go away. And the doctor might treat you for gas, not knowing that there's a tumor growing in your intestines. Okay, stage 4. Stage 4 is the tumor is now so big that it starts spreading to the other organs. Now you see in stage 1, the tumor spreads to the lymph nodes. That's in the transverse colon. And if you look at stage 3, it gone into the blood vessels, starting to carry the tumor of the cancer cells. Stage 4, once it leaves your colon, guess where it goes? Tell them that it goes after the colon. Once it leaves the earth, where it goes.
Thank you.
Once that cancer is in your colon and it gets to stage 4, it leaves the colon and it goes once it must go. Name the organ. Your liver. Hey, Dan, you're becoming a herbalist, brother.
I'm trying.
That's why you're going to need a man to learn the stuff, ain't it?
Yes, sir.
That's right. So once the cancer is in the 4th stage and the cancer leaves the colon, the first organ that cancer hits is your liver. And once it gets into your liver, you have more troubles because your liver have over 500 functions. And it disrupts the function of your liver. And it disrupts the function of the enzyme in the liver. And once the enzyme function is distorted, and the enzymes start to get higher in terms of numbers, ASE, SGPOT, alkaline phosphatase, your globulin factors, they all start to go haywire, you're going to have trouble because the cancer will leave there, and the next place it goes where? It goes into your lungs. That's where it goes. Because the lung is metal and the liver is wood. What cut wood? Metal. So once the cancer leaves the liver, it goes to the lungs. If the cancer is in the lungs, it goes to your liver. Or it goes to your brain. So once you have that tumor growing in your belly, and you get into the 4th stage, it starts spreading to first the organs, and it goes straight into your liver. And if you get into the nodes, automatically in the nodes, it gets into the lymphatic system, and then you start to have swelling of your feet, swelling of your belly. All right? And that's the problem. You understand? That's how it works. All right? So then you have to try to prevent yourself from coming in with colon cancer and brain cancer. All right? And when you have colon cancer and it moves and gets to your liver and it goes to your lungs, the next place it goes is to your brain. And in order for you, the colon cancer patient, to remove the tumor from your colon and from your brain, you must keep what clean, Dan? You must keep the colon clean, the earth clean, and you must keep the bloodstream clean from acid. And once the bloodstream is clean from acid, your tumor will start to shrink, because there are herbs that shrink tumors or have anti-tumor activity. We're going to tell you what they are now. Go to the next chart there. Look at them right there. GABA, L-theanine. I think it's L-T-H-E-A-I-N-E, so we spell that wrong. Thiamine, that thing is that's B1, but it's L-theanine, GABA, magnesium in the liquid form, capsule or powder, not in the tablets. So good for you. And don't forget, once you have brain tumor, a brain tumor in your brain, you must implement melatonin in your diet. Must. 6 milligrams every day. It is one of the best antioxidants for brain tumors. so because melatonin is found in the pineal gland, and that part of the endocrine system deals with the spiritual aspect of your life. So melatonin is very significant to take when you have a brain tumor or any kind of cancer. Angioblock. Angioblock means that we preventing angiogenesis. We are preventing the cancer from creating what? Blood vessels. Because for your cancer to grow, your cancer must create blood vessels to feed like your natural cells do. And if you keep on feeding your cancer cells junk, garbage, sugars on a regular basis, your cancer cells will start creating blood vessels. And once these vessels are created, your cancer cells will start to feed on these vessels and your tumor will get bigger. But when you implement angioblock in your diet, when you have any type of tumor, the angioblock prevents angiogenesis. So it prevents the cancer cells from creating blood vessels. So what happens then? The tumor shrinks. Because the cancer cells cannot create the blood vessels anymore and they can't grow, because they can't feed. And that is what the medical system don't know yet. So they cut you open and take out this and take out that. But they don't teach you how to send the cells back to the resting place. They don't teach you how to have your what? Your transport system working properly. They don't teach you that. You know what I mean? Your transport system. You have to have your transport system working well. You cannot afford to let your free radicals steal your electrons. You're supposed to have your good electron transport system. Once you have your free radicals stealing an electron, they will become impaired. And once they become impaired, they will get lost. And once they get lost, they're going to end up in a part of the body where they don't belong, and you're going to get cancer there. Bottom line, red clover. Red clover have lots of anti-tumor activity. We shrink tumors with that particular herb. In the brain, in the lymph nodes, in the belly, in the uterus, in the cervix, poriaco. One of the best herbs they're using, Brazil now for cancer. Doctors are using this particular herb now too. Although this particular herb is anti-fungal, we use it for women who have lots of yeast infections, but it have lots of anti-tumor activity, and it also keeps the person's sugar levels down because cancer feeds on sugar. So what we do, we will put red clover, poriaco. We will use them with dandelion root, cascara sagrada. We will use another herb there called chaparral and danqui to move the blood. And once we could get the tumor to shrink by preventing angiogenesis, then you start to have better health. You start to get better. You start to go in remission. You can't go back. If you go back, you will die. That's why Christ said, when he healed the man, he said, do not go back. He said, don't go back. Because if you go back, a worse thing will fall on you. Mm-hmm. See what I'm saying? Mm-hmm. That's why I said to them, I said, don't go back to eat the same way. You go back eating the same way, you're going to get the same disease. That's our treatment for brain cancer. Simple. Simplicity, we call it. All you have to do is keep your bloodstream clean and keep the earth healthy and clean, and nothing can grow in your body. I don't care what them doctors tell me, them big specialists. You're right. The most important specialist to me is the Most High. I don't care about them people. That's right. That's right. The most important specialist to me is the Most High. Why? Because he taught us how to eat. He taught us how to eat the foods. He gave us a diet. Not saying we go die now, but we won't have complications. All right, Sister Rona, you have some products there you wanted to ask me about?
Oh, yes. Okay, so as you know, Miss Adele, I have a family member who came to you, was it like 8-9 months ago?
Right.
And she had multiple sclerosis.
Yes.
She was a teenager. And this was one of the product that you prescribed for her.
Yes.
And 8-9 months later, I was happy to share with you that she's no longer
right.
She no longer have MS.
Right.
Well, she went to the doctor.
Doctor couldn't find her.
Yeah. They did the test, and she's MS free.
Wonderful.
So I have a lot of people asking me, just coming to me, telling me about their cancer and family member with cancer. And so I noticed that this product here is one of the many products that you recommend prescribe for cancer and other diseases as well.
Especially autoimmune diseases.
Right.
Yes.
So I wanted to ask you to explain why this product is so important for those diseases.
Well, first, Sister Runa, first I want to say that this particular product was made by a cancer specialist, a doctor who is trained, or who's an oncologist who's trained in cancer treatment. And he's a wise doctor. And those are the doctors that I look up to, you know what I mean, because they help people. And his name is Dr. Jeffrey Doms, and he's from Germany. So what he did was, he used lots of minerals, vitamins that the body needs in its natural state. But he complemented them with plants, with herbs, and herbs like the mushrooms. And he put herbs in there for liver detoxification. Because that particular doctor understood the, see? So what he did was he put all these herbs with these vitamin minerals in the raw state to feed the body and to feed the immune system. And if there is an imbalance in the immune system, he put herbs in there also to balance back the immune system, suppress it like the steroids do. See? So once you have an autoimmune disease and you take that particular product, it helps to balance back the immune system. The problem, though, you can't find it because it's off the shelf. Because, we talked to Diana because somebody was concerned about lead, and I had to talk to them. Because once I have a customer who is complaining about something in a product, I will call the company. That's how I work. And these companies have doctors on the compound. They're biochemists, and they will explain to you in detail why it's there, how much the amount is going to harm you or not. And then, so we had a long conversation with her, and she also said that the product is very safe, so and it's helping a lot of our people. So that is one of the products that I recommend for lots of people when they have cancer or autoimmune diseases like MS or lupus. And again, I like to promote another product that is created by the same particular company called AngioBlock. It also helps to prevent angiogenesis. But people don't know about these products. They don't know because the medical school teaches that. And that's the reason why I promote it as well. Yeah?
Where can they get those products?
Well, Ambrosia have it, but again, it's back. It's in back order now, and that's the company. The companies ran out of it because everybody's buying it now, and because it's working for lots of people. So the company's out of it now, but I think they'll have it's going to be maybe next week or week after it will be back in stock again. All right. The company name is Allergy Research Group. You can call them, but it's very expensive there. As I said before, you can buy it from Ambrosia. We sell it in Grenada. If you live in Grenada, you want to have that particular product, we have it also. But Ambrosia has it, and you could get it in another store also if you like to, if you're living in another state. And you could find a vitamin shop. I think they carry it also. Yeah, wonderful. It's another product we want to talk about.
So you carry this product?
Yes,
right?
I do.
You do carry this product?
I give it to all my cancer patients.
Yes.
Yes, I do.
Yes.
And again, I give them with NAC, especially if the cancer patient is taking chemotherapy.
Okay.
If they want to choose that route,
right,
we will give them NAC and glutathione. And what NAC and the glutathione do is they prevent the chemo from killing the good cells, while it's killing the bad cells. I think that's what the NAC and the glutathione does. Yeah. All right. Yes. So another product.
You also have another product that I noticed that you always mention as well, and this is called Pro-Greens.
Yes.
I believe this is also something that you prescribe to my family member.
Yes.
Could you explain what this is and why it's important?
Wonderful. Yes. Pro-Greens again. You know that we always try to get the body to be alkaline. And what I try to do for people who have cancer is to raise the pH from 7.0, which is neutral, 7.45, and I go to by 7.8, 7.5. I would push it that high, so I go to even 8.02. And I don't want people to say because I'm saying that we raise the pH higher than normal that you can be cancer free from it. You know what I mean? I don't want people to come and say that I said that. You can. It's as much easier to fight a cancer when the pH raises at that particular level. So what the pro greens do, there is lots of greens in there. They have the chlorella, there is barley grass, there's wheat grass, there's spirulina, all the greens are there, and it's alkaline in the blood. So keep the pH at 7.5, 7.8. But the beautiful thing about that particular pro greens also is have lots of probiotics that keeps the intestinal tract healthy in case you have colon cancer. With all the bad bacteria, it builds the immune system. It keeps the pH at a level whereby it could keep you healthy because it keeps the cell well, and then it also helps you to keep the bloodstream healthy because there's a lot of chlorophyll in that particular product. I mean, what chlorophyll do? It keeps the blood well, keep the blood clean, all right? And that's the reason why I like to use these products, because they're very effective and you get good results from them. Yeah, that's the reason why.
Thank you.
You're welcome, my dear. All right, and we're glad to know that your family member is doing wonderful, and we have a lot of other people who have lupus, scleroderma, RA, and they're doing well once they're being guided to use product that works for them. All right, any questions?
Oh, you know what? That family member that I mentioned earlier,
Yeah.
that no longer has MS,
Yeah.
she would like to come on your program and give a testimony.
Wonderful.
On
would,
her progress.
Appreciate that.
Yeah.
Yes.
So
we're going to have her
try and get
New
her
York.
on here.
Wonderful. All
Right.
right. Wonderful. That's wonderful. Yes. So you see that we're going to take documentation. We had a cancer patient here who went to Cuba, went to America, did chemo and radiation, and she had liver cancer. And the cancer went to her lymph node, and she came here for 1 month. And doctor who came, because I work doctor here, and we could have the local doctors, you know, in the open mind, that is. And the doctor was amazed that when she came, her feet was all, her leg was all big, and in 1 month it was all gone. All the swelling was done, soft as usual. And he was saying to me that we must start documenting our treatment to our patients, very important, so that when we go from big to small, we know that we are improving. And that's what we're trying to do now, so that people can have a better understanding of diet, because diet is very significant. Once I changed her diet and she came under my restriction, and I taught her how to eat, how to juice, everything went back to normal again. Everything went back in balance. So that's very significant also. Yeah. All right. So we're going to have a few other people who and they're cancer free. We're going to have them testifying, and you know that the medical system said that they had it, so can't doubt it now. And once you put the body back in balance, you're going to be okay. I like to use a lot of vitamin C also, a lot of vitamin C. I like to use it buffered. And when I use it buffered, I use about 20,000 milligrams of vitamin C per day buffered, meaning that when it's buffered, it keeps the pH in balance. And when the pH is in balance, then the cancer starts disappearing. Okay, so we have to work on teaching more people how to use these products and how to stay well, how to eat to stay healthy. That's the key. All right. Any questions we have before we leave? Because we have to go and do our rehearsal for the big show on Friday, man.
Yes, sir.
You coming on stage with me, brother?
Yeah. That's what it is, man.
Yeah, we're on a big show Friday. Don't forget
A few questions.
Pure Grenada Music Festival on Friday night. And we have lovely Lily here. Gonna be all singing behind. You know what I'm saying? Yes, that.
Listen, guys, make sure that you subscribe to Dr. Patrick's new YouTube page. This is his new YouTube page. So make sure you guys subscribe, because this is where all the information is going to come out. So hit the subscribe, hit the like button, and also drop a comment. Let him know that he's doing a great job. You know what I'm saying? The brother is going hard for us, bringing us all this cutting edge information. So let's make sure that we show him our appreciation. All right?
Yeah. It's love, you know? Yes.
Cynthia Hammett wants to know that if said her friend has ulcerative colitis.
Yes.
She's 36. What can be done for that?
Well, the presentation we had a couple of days ago on bowel disorders, she have to look at a particular presentation.
Okay.
If she look at that, she could get all the treatments are there. Because once you have ulcers, it's a sore, and you have to soothe it. And that's why you have to use what we call the mulcent plants there. You ever have plants that fall, we call them the mulcent plants. They seem to soothe things because they have mucilage. And then we have plants we call astringent plants. They seem to heal the tissues of the body. So you have to know what plants to use for what condition. So if it's an ulcer, we use sea moss. We use marshmallow. We use cyprian because they have the what we call the mulcent plants. They seem to soothe things. If you have trouble in the tissues, you use astringent plants. You know what I mean? And because they have to soothe tissues or keep the tissues healthy. So you have to know what the condition is and what plants to use for that particular condition. You know? So you can go back to that particular presentation and look at the program. Okay? Yeah?
Brenda
really
Peters.
quickly, I have a question really quickly. Someone asked me to ask you earlier, what are some good natural proteins that can be taken? Do you have any suggestions?
Spirulina have a lot of protein. Spirulina have more protein than chicken. Spirulina have 54% protein. All right? And you have certain vegetables that have proteins too. I use a lot of nuts and I use a lot of beans, but beans are not a protein food. A lot of people have a misconception of beans. Beans is protein. Beans are not proteins. Beans have more starch than protein. It's really a starch food. You know, they have 70% starch and 30% protein. But those are food that you can get protein from. You know what I mean? Because you only allow 60 grams of protein per day, no more than that. You know what I mean? Because they're building foods, but they also stock similar food. So I like to just keep that limitation of the protein, and protein should be eaten in the morning time. You know, so beans, nuts, seeds, spirulina, you know, if it's not flesh, then you're looking at these kind of food that have it. You know what I mean? And if you have it, get your 60 grams per day. And don't forget again, I said we should only intake 20% of our diet should be protein foods. 20%. 20% of your diet should be what? Fruits. Don't forget that now. 40% of your diet should be legumes, peas and beans. And 80% of your diet should be green, leafy things because they keep the body alkaline. See? So some people come and say, you know what? I drink alkaline water, but eating acid foods every day. You never alkaline your blood that way. You spend it up in mud. See? So we have to learn how to eat the foods, and that's why the BioLife program is significant. So what we're going to do, we're going to talk to Dan. Dan is here in Grenada right now. He's here for a couple of more days. I think it's about 10 more days. And I want to try to get him to download that BioLife program, which is an alkaline program that people could get, you know, free of charge. And then you can learn how to take care of your bodies. Okay? All right. We're going to try to get Dan to do that for us as he's here. All right? Because I'm computer illiterate.
So I had one more question, and I'll give it right back to you. My brother was asking, I know you went over this before, but if you could repeat it. Yeah. When a brother reaches a certain age, his libido kind of goes down.
Yeah.
So what would you recommend as yeah. He said, not me. Not mine. What would you recommend for brothers to, you know, say, build and boost their stamina?
You see, I got a young girl. So you're not making no joke. She got a whole she corner too. Yeah, I'm saying. Yeah, man. Well, you know, I always tell men, once a man past the age of 30, he don't produce sperm every day. He produces sperm every 3 days. So you're not supposed to have sex every day. See? And then a lot of the men that pass the age of 30 and 40, they start to have what we call low testosterone levels. Testosterone start dropping. See? And that's why we check the testosterone levels in men over 40 to see how low it is. If it's low, we give them a product called testosterone RX to build it back up. See? Because you can't get it too high. The higher it is, you get prostate troubles too. So be careful with testosterone. And that will help to give you energy and have you have more sexual activity. I ain't taking it yet, but you know, I'm taking and then again, lots of men have bad circulation. And that's the key. If your heart don't work good, your penis can never work good. You have to have good heart health in order for you to have good penis. So don't forget that. See? Because it's blood flow. If the blood goes into the penis and the valve can't close because there's plaque in the walls, in the veins, in the arteries, and the valve can't close, you will have in the pineal artery, you'll have the blood going, the blood goes in, but the valve is not closing properly, like the ileocecal valve in your intestines. It don't close, so the blood goes in, you get an erection, but you lose it because the blood won't stay. Garlic fix that. Garlic and bamboo leaf garlic, bamboo leaf, katuba, mariopuma, 40 powder, a lot of them, they work because they keep moving in the arteries up. When the arteries are clean and the heart is working properly, and you have good testosterone balance, man, 80 years old, like the doctor said, we had a child at what, 79? We still breathing him. Yeah. So I'm saying, bro. That's right.
Patrick, you're killing me tonight.
That's what I'm saying.
I have a couple of questions for you from your audience. Brenda Peters asked this question twice. She says, how can someone get rid of mucus in the stool?
Mucus in the stool again come from mucus colitis, and I said, I think we had a program on that a couple of days ago. We did the program on bowel disorders. Once there is bacteria, excessive amount of the bad bacteria in the bowels, the bad bacteria look to go one place. When they become very overactive in the bowels, they start to go into the mucous membranes. That's where they look to go. Now, once they start to go into the mucous membranes, the mucous membrane in its wisdom do not want the bad bacteria to enter there. And that's how we fix HIV and herpes and the papilloma virus, all the viruses. We fix them by cleaning up the mucous membranes. That's how you fix viruses, keeping the mucous membrane clean. So once there is an excessive amount of mucus or an excessive amount of bacteria in your bowels, the bacteria overtake the good bacteria and try to get into the mucous membranes. Now, the mucous membrane do not want the bad bacteria to get in. So what he does, what he produces, Rona? Mucus. Mucus he produces, why? Because he is trying to prevent the bad bacteria from getting in there. So he produces mucus. So he traps him. That's good. The only problem with that is, though, you start seeing mucus in your stool, and the doctors call it mucus colitis, and they say there's no cure for that. Simple cure: get rid of the bad bacteria in your bowels, increase the good one, the trillion of them inside there, and your mucous membranes will not produce lots of mucus. And you wouldn't see mucus or cold in your stool.
Someone have just one more question for you.
Sure.
Carasee Telsford. She said, I get a lot of pain in the left side of my stomach, but I use the bathroom twice every day. What test can I take to see if I have colon cancer?
Well, colonoscopy. But if some people say the stomach is over here. That's not your stomach. That's your intestines. Your stomach is right here. That's your stomach is that. See that? So if you're getting pain here, that's your stomach. If you're getting pain here, that's your intestines. Yeah? Right over here. That's your intestines. If the pain is over here, that's your stomach. Now you can have the pain over here, and because your gallbladder is over here with your liver. So if you have gallstones, she can get pain over here too, in the stomach area. So you go to her back. Right? So if the pain is over here, that's not her stomach, that's her intestines. See?
So she's having issues in her intestines.
Right, in her digestive system. So she's going to have to, she want to find out if she have colon cancer, she can do a CA 19.9 test. It's called a carcinogen antigen test. They look for a protein that's in the blood. And that's a cancer marker for the pancreas too. If it's high, the doctor will send her to get a colonoscopy. And with the colonoscopy, the doctor will put an instrument in her rectum and look at a screen, see there is polyps there, or there's growths. And if there's growths, then he will say that she has a tumor in her colon that will give her the pain. But she should do the gallbladder flush and then see if the pain goes away. If the pain goes away after the gallbladder flush, she just had stagnation. If the pain don't go away, go see a doctor and try to get a colonoscopy done. Yeah? Right? Wonderful. Okay, think we got to go now.
Got to go. Listen, family, once again, please make sure you hit the like button, and most of all, make sure you subscribe. Subscribe to Dr. Patrick's page. Let me show y'all something real quick. Let me share my screen really quickly. I want to show y'all something very important.
She outside? Okay. Sydney or son? Sydney or son? Tell him to call you. Come.
All right, family. Y'all see this bell right here at the top? Make sure that you hit that bell. After you subscribe to his channel, make sure you hit the bell because the bell sends you a notification every time that he's going live with new information. Now, a lot of y'all have been trickling into the room a little late. You missed a lot of the live stream, so you can go ahead and go back and watch it. But make sure you hit that subscribe button and hit the bell. That way you get a notification when Dr. Patrick is going live. All right, don't forget, let's show him some love. This is his new channel. He's continuing to give us this powerful information. So let's just continue to show him our support, all right?
Yes, and don't forget, love cover all things, you know. You have to love each other, help each other, teach each other. Each one teach one. And the most of all, we have to give thanks and praise to the Most High for the wisdom and knowledge that He gave us to pass it on to other people. That's the key, man. The key is to teach our people to stay well. That's what it is to me. I mean, wisdom and knowledge is what I want. I don't want riches. I could live comfortable and nice and help other people. That's what I'm all about, you know. Yeah. Blessed love. Give thanks.